There we go. Because I know there's some folks that aren't able to attend live. We want to make sure everybody gets all of the information. But we will be recording this, posting it to our YouTube site, and sending out the links. Also, for any of the documents or resources or websites that we talk about today, we're going to send out a comprehensive list of all of those links or information so folks have them. So if you don't catch a website or you don't feel like you have to write those down, this is really intended to be more of an FYI, and you will get that information. We'll be sending it out likely tomorrow. Also, we will stop kind of in the middle for a opportunity for asking questions, but also if something comes up, feel free to unmute or type something in the chat box and ask questions. That is allowable at any time. Okay, let me start sharing my slides here. Here we go. So today's call is really about making sure everybody's updated on some changes that have occurred. Some of the things will be reminders, and some of the updates we're going to be talking about are going to be brand new. So very excited about that. We're going to start with things that are more broad, so not even necessarily specific to people receiving ICAPP funds or working for an ICAPP funded program, but it'll be more general. We have a lot of supports and services that we're able to offer to anybody in the prevention network. And then towards the end, we'll focus just on the things that are relevant for ICAPP funded programs. So if that's not relevant for you, you'll be able to jump off and not have to listen to things that aren't as relevant. The first thing I wanted to talk about, because January will be here before we know it, and also it is an election year, we want to encourage folks to be active with advocacy opportunities. So I know I've shared just within the last couple weeks some opportunities for things that have come out in different areas of the state. If there's going to be candidate forums or chances to meet and talk with either candidates or your elected officials about programs or the needs of kids and families in your communities, we're going to be doing our best to update folks whenever those come around. If you have things that come up that you are aware of, also please let us know. We may be able to help spread the word. We may be able to provide some resources for you if that's something that you're interested in. But the more we can get issues about kids and families in front of decision makers, that's always a great thing. Aside from elections, we are also working on, what's our policy agenda? What are the things that our network partners are hearing about from kids and families? Not that there's not a million things that are important to kids and families across the state, but really trying to narrow down what are the top issues. And, we have some initiatives that I would say are near and dear to our heart as an organization, things that we're passionate about, but we also want to make sure that we're listening to our network partners and understanding what are the things most important to them, or what are the things that are coming up in your communities or that you're hearing that you would love to see as a priority area on our policy agenda. Not meaning to put folks on the spot right off the bat. If you have things and you want to put them in the chat box, go ahead. I will be sending out a short survey, and it's just going to be a question or two to identify, what are the biggest priorities in your community or that you're seeing for needs for kids and families. And so that will come out with the list of resources and documents and everything we're going to share on the call today. So I wanted to plant that seed and encourage everybody to respond to that and just be as as active and vocal with those types of activities as possible. I know that there's been concern in the past that people think, oh, I can't lobby as a part of my job. Really identifying big picture issues, providing education to decision makers is really not considered lobbying, or even like, sending information to the families that you support, or helping to connect them if they have a passion project or a passion issue that they would be a good advocate for themselves. That is not necessarily considered lobbying. There's a lot of education that can be done under raising awareness and general education, community engagement that is not considered lobbying. Lobbying really is about a specific policy or a specific like funding request or something along those lines. Sort of along that line, but I'm going to move to all right, thanks, Lori. Just checking the chat here. The next item on the list is ACEs coalitions. We work closely here at the state level with ACE 360. They've mostly been working in the central Iowa area, but I know they've been supporting folks across the state. I know recently there's been some coalitions that they have helped to start up. While I think that is great, we also want to make sure that we are supporting that and we are helping connect people. If we know of a child abuse prevention council, we want to make sure that they're connected. If there's another group of people wanting to set up an ACEs coalition, really just working smarter and not harder, and helping make sure that people are connected to work that's already going on in the community. So if that applies to you, or you've heard talk about people becoming interested in setting up an ACEs coalition, please loop us in just so we can help make sure that all of the connections are made, both with our state partners, but then that they're connecting with local partners, making sure everybody's connected. A lot of times I know different coalitions often have many of the same people sitting around the same table, but that's not always the case. So we can help be a resource for that. Also, I know of some funding opportunities that may be available for like training or technical assistance if people are working on ACEs coalition development, or capacity building in the like advocacy type of initiative. There may be some support there, additional support there for that kind of activity that we can help connect people with. We always want to make sure if there's resources available that you're aware of them if they're pertinent. Let's see. A couple other things that I want that are really more general. About halfway through Prevention Month this year, PCA America started rolling out the Building Better Childhoods campaign. I'm going to stop sharing here and share. I've got a million things to share today. I apologize because we're going to be flipping back and forth, but I am really excited about all the things that we get to share. And hopefully everybody will be able to have screen to share. Just a quick video about what you can expect with the Better Childhoods campaign. Can you hear? Okay, let me try this again. All right, why is my thing not popping up for video? Maybe we'll come back to that, and Kylie, if you have help for me, I might ask you for that. I'm not sure why the video or why the audio is not playing, but if not, I will send the link. I will go back to Better Childhoods. The video I was going to show is like a quick 1.5-ish video. There's also a bunch of tools within this toolkit, different talking points for talking about childhood adversity, making it a public issue, making it a preventable issue. Lots of tips and tricks for talking with different audiences about this issue. And then there's examples in the toolkit. Let's see, media relations. So there's different tools for preparing for an interview where you're talking with media, different do's and don'ts for talking about this topic, and then different things if there's a crisis in your community, helpful hints for talking with different audiences about that situation. So the buildingbetterchildhoods.org information available for folks that we want to make sure that we are sharing with you. And we've been rolling some of this out, but we're going to continue to roll that out. I want to make sure folks are aware of that. And let me go back to my slides. Here we go. Am I sharing my slides okay? Okay, great. Kylie, I'm gonna let you talk about the by the numbers resource, resources that are under development for all of the counties.
Sure. So this actually is part of the conversation about advocacy, but this is something that we are working on, kind of a new project that we are excited to roll out. We've been calling it the report card. That makes it sound a lot more ominous and judgy than it is. What we're really doing is we're trying to get a 99 county lay of the land for what the conditions are for children and families in each county in Iowa. So in addition to looking at maltreatment numbers, we're looking at things like housing and maternal health and child and family well-being, and kind of putting together a really comprehensive but still digestible infographic style overview of what the data shows about the conditions in each county in Iowa. And the idea is that this is an advocacy tool for you, but it's also a way for everyone to be connected, so that, you know, when you get your county report card, it's going to have your name on the back. It's going to say, you know, we have home visiting programs happening at this agency. We have ECI home visiting being done here. We've got Head Start. These are the Head Start people, so that it's a talking point for you. So it's like, look, these are the conditions in our county, and also how do I connect with the people doing the work? So that is something that we are just starting to kind of get all of our data pulled together, and we're going to be designing and rolling those out over the next month or two. We really want and hope to have everybody involved in these as they go, rather than this being a thing that we deliver to you. So we would love if you have photos of any cool like CAPP month stuff that you did, any activities that have happened, any like community events. We would love to have those. Just pass those along to us and let us know what you would like to see in your county's report. Also, if you have any like factoids or pictures or any cool landmarks in your county that you think should be included, it's really important that this isn't a thing that's being delivered from the statewide level to the county level. We want to create this in partnership with you. We want it to be something that you can use and something that is meaningful for you when you're talking with a legislator or a funder, to be able to say, this is what we're doing, this is what our families are going through, and this is how we're working to build better childhoods. So should have a few examples of those out in the next month or so. In the meantime, please send us anything that you would like to see in that, any photos, any snippets, any contact people that you think would be important to include. We would love to have that.
Thanks, Kylie. Along with that, we are asking everybody to update council contact information. You have to look for it, but there's a spot on our website for people if they're looking to find their local contact person. We do our best to update it as we become aware. But sometimes when we're working with specific projects, we don't always know if like the chair of the local council has changed, or we don't update it as often as we should, but we are working to do that in a more timely and regular manner, just to at least review it and look at it thoroughly more periodically, and then we'll still update that as needed. The link for where to find that local contact information will be included, and we will ask everybody to send us both a verification if things are still the same, as well as any updates. And this again isn't just for ICAPP grantees. We support the whole state. We want to be a resource for the whole state, and so we want to make sure we have that for all folks, whether or not there's an active contract or not. Okay. All right, next we're going to talk just briefly about the Health and Human Services alignment. Information can be found at hhsalignment.iowa.gov. I've encountered a lot of positive attitude about this alignment and the expectations that this really is going to lead to some system improvements, improve services for kids and families. Also, I think with any change, the unknown can produce a little bit of anxiety. So we just want to pass along any updates when we become aware of them. This website, I'm going to stop sharing again and then pull up the Health and Human Services website so folks have an idea of what that looks like. So this is the main page for the Health and Human Services updates. There are updates that are posted here all the time. They've got weekly updates, different communications, project documents, just to make sure folks are aware of this. And there's a couple of updates that have come out recently with the new and improved org chart. I do want to preface this by saying this is a process. This is a huge undertaking to take two separate government state departments and merge them into one. So I anticipate the implementation will take a while. Things may change along the way. It is intended, I think, to be a somewhat fluid process, that if things aren't working, they can make improvements along the way or make adjustments, and that this implementation isn't going to, we're not going to wake up one day and everything is completely different. It's going to happen over time. But we do have a new DHHS organizational chart. With this chart came a resource document. How is that relevant to us? Under the Family Wellbeing and Protection general umbrella will be adult protection and services, as well as child care and family services. In the family services, that's going to include early access project launch, HOPES, the McV program, the Early Childhood Iowa program, and then the ICAPP program is listed in there as well. I don't know that that's a huge surprise to anybody. We know that there's a ton of overlap with Early Childhood Iowa, and our ICAPP programs, as well as a lot of the other family support programming across the state. So that's the intention as we know of right now. What that's going to look like when everything transitions, a lot of that is still up in the air. But like I said, we just want to make folks aware of information as we become aware of it. I know Leslie is on the call. I know there's not a ton of additional information, but I didn't know if you wanted to add anything, Leslie.
Yeah, thanks for the summary, Abby. That was wonderful. You did a great job kind of explaining what's currently going on. And I just want to reiterate what Abby said, that this is really looking like it's shaping up to be something that will ultimately benefit families and children here in Iowa with this new restructuring of IDPH.
Uh-oh, Leslie, I'm not able, you got muted.
Does that work?
That worked.
All right, I guess I can't use my headset today. That's totally fine. So what I was saying was that Abby did a great job summarizing everything. And just to reiterate that this change will be at the DHS level, but all of your existing contracts will still be valid and stay the same. So the impact it will have on you is hopefully just better collaboration with other departments that are currently separate now. Will be working more closely together, and the benefits should be really coming down to the children and families here in Iowa. So I hope if you have any other questions, there isn't a whole lot more information other than what Abby shared, but I'm happy to try and answer them if you have a question right now.
I am peeking at the chat box and I'm not seeing anything pop up yet. I know somebody asked in here when the recording would be out. I will make sure to send that out to my entire distribution list. I anticipate, I mean, sometimes it takes a little bit of time to upload, but it should be by the end of the day tomorrow. I am not seeing any questions about the alignment though. We will have time for questions here in a bit though. So I'm gonna go ahead and move on. Thanks, Leslie. And share my screen again. Okay, moving right along to some additional general updates. Some of these resources folks I think have seen, some of them are new, but I just wanted to go over. We have been working with Flynn Wright, and a lot of this came out of our sexual abuse prevention statewide work group. Really wanting some good information to be able to provide for sexual abuse prevention, for handouts. Both, we know there's a ton of information we want to give to people, and then sometimes it's helpful to have those little snippets of information. So we started with, we call it the SAP toolkit, but it really is the adult's guide to grooming. So it's recognizing healthy and unhealthy boundaries, seeing ways to make kids safer, especially if they're in like an adult-child situation or a child and an older child situation. And really, what does grooming look like? And what are some of those red flag behaviors? What does it mean to violate boundaries? So those signs of grooming, there's a little section on keeping your kids safe online, because we know that sometimes people with bad intentions towards kids are reaching out to them online. And then things that adults can do to keep kids safe, how adults can respond. A resource page for, I don't have this digitally, how to get help. And then some of those tools that have come out as a result of this. We've got little, like a little grooming card. So kind of what's that range of behaviors from healthy to concerning, and then a game plan. We have a little card, kind of a bookmark size, for keeping your child safe online. And then we have a one-pager that is 10 tips for healthy boundaries. So we're really excited. Those are our brand new SAP resources. And again, I want to say thanks to our work group members, people working in sexual abuse prevention across the state have really helped to shape what we need and what it looks like and what kind of content is included in there. So those will be available. We've also got, I know a lot of folks have seen these. We had these available for CAP Month, the 10 ways card. So 10 ways to bond with your baby, 10 ways to keep school kids sharp, 10 ways to bond with your teens. These are now available in Spanish as well as English. For CAP Month, there was a ton of interest in these. And so we're excited that we were able to get them translated and we were able to order additional resources. We also still have these postcard size things parents need to hear and things children need to hear cards. Those have not changed. Those are still available in English and Spanish. We have, this isn't on my slide, but we have magnets, and that's 10 questions to spark conversations. That kind of came up as a result of some of the other things we're doing, but also with the sexual abuse prevention materials, wanting to promote positive ongoing communication with kids, whether they're 4 or whether they're teenagers, and different topics so that you're having good conversation with your kids every single day. And so that it's in a magnet form. So it's just kind of that visual when you talk to parents about having that open, honest, calm communication. They can take that magnet home and think about like, oh, what would you do if you won $1,000 in the lottery? Just as a way to spark those conversations and ongoing relationship building with the kids in their lives. That is that one. We do have several different resources available as well, still from Sesame Street and Communities. We have the RAP cards. So it is 5 things to know about kids and feelings, 5 ideas for expressing emotions, and the Breathe, Think, Do cards from Sesame, really intended to be a supplemental resource for those conversations you're having with families about how they can foster social emotional development with young children. We have several boxes of I Can Name My Feelings, like activity coloring books. And then we also have resource kits, and it's really about building resilience. So there's RAP cards, there's books, there's things like that, maybe not for individual kids and families, but maybe it's a teacher at a preschool could use those. Kids and families could use them as well, but I think the intention is because they come in sets of 50, that they might be good for supporting a couple of classrooms. That is a lot of resources. I will say we will have some of all of these available at the in-person regional meeting. We're going to talk about that next, but the in-person regional meeting down in Ottumwa, we will have a whole bunch of resources available for folks who are attending that in person. So we can just give them to you. If you want a sampling of what different things we have to offer, we can send you like a manila envelope with just one of everything so you can take a look at it. I will say I want to make sure folks are mindful about what they're ordering, and if you have a specific audience, whether it's the families that you're supporting, or if you want to pass things out at a family resource night, or if you're doing sexual abuse prevention training and you want some of those supplemental materials, because we do have limited resources. Are they for purchase or cost, or are they free? Right now, anything we have, and we have quite a bit of things that we're offering for free. We're not charging. If we feel like we have a lot in postage, if people are requesting a lot of things to be sent, we may evaluate just charging for postage. But I also, because the things are limited, we only have a certain amount that we're able to give out. With the SAP toolkit booklets, we want to make sure that we have like a specific audience that is going to get those. We just want to make sure that they're being utilized and that people aren't getting 100 if they really only need 30. And so we also want to make sure people have a chance to look through these, especially the new things, so that you can see what they are and think about the different audiences, whether it's like the people in the business community or families. I will say we're really excited about the toolkit booklet, but it's 14, 16 pages, so it's a lot of information. It might not be the best resource for a family. The smaller snippets might be better because it's just you know, like smaller bites of information. It's more condensed and more succinct. If there are specific resources, like if you've gotten the 10 tips for bonding with teens cards and you went through a lot of them and people really like them, you know, contact us and we can talk about how to connect with you to get those. We will be doing something for Child Abuse Prevention Month again, and I'm sure we'll have some resources available again on a limited basis as funding allows, but we know that has been helpful. We've gotten a lot of great feedback, and so we want to continue to provide those. We just can't provide everything in unlimited numbers. So we want to be mindful of what's the most useful. What are people finding that their communities are really responding to? But great question. And if you come to the in-person regional meeting, you will be able to take some resources home from there. Also, I know it's in Ottumwa and that's not convenient for every location across the state. But as we're going out to different locations, we will make sure to have some information and resources with us so folks can get them that way as well. Anything I forgot on that end, Kylie?
I think that covers it.
Okay. Okay, the next update is about travel reimbursement. Really excited that effective July 1st, the state reimbursement rate increased from 39 cents a mile to 50 cents a mile. People don't need to do anything. We're not doing amendments because in the language of the contract, it references the Department of Administrative Services policy, and that is what the Department of Administrative Services policy is. The website is on there. If you Google Department of Administrative Services Iowa, it'll take you to their webpage. You hit travel and relocation, and it'll get you all of that information, but I will also send the link. The hotel reimbursement is now a single room rate of $80. And I do want to make sure that we're reminding everybody that ICAPP billing hotel rooms to ICAPP, in order to be billable, the hotels need to be in compliance with the human trafficking policy. There's a training that hotel personnel need to take have that verified in order to receive state rate reimbursement from the state. Questions on that? I think everybody's gotten some information. We've sent out information about that, but felt like it was a good time to remind everybody that has changed. As I mentioned, sent out a couple of emails about regional meeting registration, September 20th, 22nd, 28th. The Ottumwa is in person, the other two are virtual. And again, we are doing these in partnership with the Community Partnership for Protecting Children program. A lot of overlap in folks that are ICAPP folks and CPPC folks. We want to, be mindful of everybody's time if we can consolidate in one meeting and work together. We've gotten good feedback from that in the past. Another training that will be offered. We do not have this up on Eventbrite yet, but I wanted folks to put that on there, save the date if they are interested, as we'll be doing a 2-day Youth and Families Thrive. Will likely be held in, I don't know if it'll be Des Moines or the central Iowa area, Des Moines area in general. But we will get that information posted once we have a location. Let's see. With the SAP toolkit, we'll be doing a short webinar to go over some of those resources more in depth, and we'll provide some kind of tips and tricks or things to think about as you're talking points, things like that, as you're utilizing these materials. We'll talk about considerations for how to use different materials with different audiences. And then another training, we've had a session requested related to serving diverse communities. So really adapting programming and adapting community resources and cultural considerations to a changing community. So that is in the works, but I don't have a date for that at this time. I'm gonna stop real quick. These are DAISY updates, and that'll be the last thing that we talk about until we talk about ICAPP specific things. I did see a question in the chat I wanted to answer. If you're in Des Moines, can you stop by and grab some? Yes, just connect with me and we'll get things ready for you to pick up. But yes, that is definitely, we can connect if you're in Des Moines to figure out how to get you some of those resources. Good, great question. Okay, not seeing any other questions. So I'm going to move on to the DAISY updates. There was a webinar last month that went over some different things that were going to be updated in the DAISY system. So the home visit form is going to be updated to be included in the FSSD. And what that is, it collects information about the actual visits. There is a discussion that that this visit form could replace like other systems that people may have for collecting home visiting information and notes. So like the dates and times and families and all of that. This can be used. It is not intended to replace that, and it isn't at this time at least able to be used for reporting. So even if you're filling out the home visiting form for every visit, we still have to do quarterly reports to document the number of groups and number of visits per family. I wanted to make sure I clarified that with folks. And also to remind folks that it is not required for ICAPP programs. Also, I don't speak for any other funders that use the DAISY system, so I can only speak for us. Another part of that call, excuse me, was Janet talked about the PFS2 being added to DAISY. That will be happening in FY23. Not actually sure if it's not on there now. It might be. As of right now, our contracts haven't changed. So our contractors for anybody doing short-term home visitation or group-based programming is still required to use the PFS. That is likely to change in FY24. We will be using this next year. They're going to update the system, and we'll have an opportunity to provide training and technical assistance around the updated tool. It's similar, but it is a retrospective. So we don't do a pre-test and a post-test at different times. We just do a post-test and ask people to talk about where were you at the beginning of services and then where are you now. Definitely some benefits in using that. But I wanted to make sure I let folks know our expectations haven't changed, but you can expect changes in the future. The other big update to the FSSD is the target child. is being removed, so people will not have to identify who's the target child. I think that's great because when ICAPP serves a family, even if the services are really focusing on maybe an infant in the home, we know that there can be benefits to the whole family, whether they have teenagers or a child that they're expecting another child, or they have an older child. And we really want to capture all of the children in the family that could benefit from the service. I know during that training, there was discussion that some programs require a target child to be identified. Does that apply to any of current ICAPP program grantees that are on the call with us? I guess just type in yes if your model requires you to identify the target child, or if you're doing so in DAISY previously, that was just because DAISY required it. Okay, I'm not seeing anything come in the chat box. And I'm not hearing anybody come off mute to say that that applies to them. So I'm not going to worry too much about that, but please, the guidance given on the call was that if we had to identify a target child and shouldn't have any other children, the guidance was to discharge the family and re-enroll them with just the target child. Before folks do that, please check with me or talk to me, because I want to make sure that we're just giving consistent guidance to folks and that I have the full picture of information if that's happening. I don't see anything that would make me think that that's going to be a huge issue, but I want to make sure that I guess I'm aware of everybody else's program requirements with their model and other funders. Okay. This is a pause for any questions about things we've talked about thus far. And I've got 2 slides left, so which are really specific to ICAPP reporting and billing processes. So if you don't have questions and the billing reporting, none of that is relevant, this is a great time for you to hop off. You can sit in. We're not talking about any super secret billing information, but I want to be mindful of only presenting relevant information to folks. Okay. Seeing no questions, I'm going to move forward. Billing changes. So beginning in September, claims will be required to be submitted in one PDF document using the correct naming convention. I know earlier this spring we talked about changing the naming conventions to be succinct, to include the contract number and then the billing period in a specific format. And part of that is just to make sure we're reducing errors on our end and that we're getting things processed in a timely manner. We also have some processes in place to automate some of the workflow and some of the filing that happens electronically, again, to help us be more efficient and reduce errors. So we do want to make sure folks are using that. If we are seeing things not in the correct format, we'll reach out to you and let you know. But we want to make sure that that is happening going forward. Beginning in October, we will be kicking things back if they're not named appropriately. Also, we will be using Dropbox to upload billing documents. Again, we will continue to receive those via email through September. Kylie, I don't know if you want to talk about changes in that practice while I bring up Shared billing. Okay, I've got a question. What is Dropbox? Dropbox is an online like document storage site. So you'll have a link and you'll just be able to click upload documents, and it will tell you when they are uploaded.
So you'll just have a link that you click on once a month when you go to submit it. You'll have it prepared like you always do. It'll just be your 2-page PDF with your GACs and your MER. And you'll just have a link, and I can pull it up, Abby, unless you've got it right now.
You know what? I have it. I clicked the link and I'm going to share my screen again.
Okay. So
Okay.
all you'll have to do is you'll see this screen and you'll click select files. And then you're going to upload whatever the billing is that you want to upload, and it's going to ask for your name. And that's all you'll have to do. And then we're going to get a file that has your name and then that's correctly named naming convention. And that's all. Rather than email it to us, you'll just have to click on that link and upload.
And then along with that, we have a spreadsheet that will have all of these links on here. It'll have the evaluation links. It'll have a place for the monthly, quarterly report, because that is changing also. We've also got a link on here for that Department of Administrative Services, so you can see all the hotels that have had the human trafficking training. We're going to try to keep all the links on there that are helpful. But for billing, we will have a tracker that you'll be able to view that will have the date we received your claim, the date we sent it to DHS, and then there's a formula in here that will calculate by which date you should receive payment. That way, if you're not quite sure, did you get my claim? Has it been processed? This is just a good internal tracker for everybody to see where their claim, like when it was sent where, or when it was processed, and then be able to estimate, you know, if you haven't received it yet, is it late, or should we give it another week or two before we get concerned that it's late?
Where it says enable content at the top in that yellow box, if you click that, that's what's going to give you the most recent version. Some of you, depending on your IT department, may not see that. You'll see something that says like external links have been disabled. That's because your IT settings are set up because they want to make sure that nobody's trying to send you a virus. So when it's trying to push information at you that way, some IT departments have that disabled. So that's something you can check with them. I mean, worst case scenario is that you won't be able to view this, but you can always ask us, you know, when should I expect this? But generally it's 60 days after the date that we pass it on to DHS. And we have 10 business days from the time we get a correct document from you to do that.
Can I upload multiple files? It looks like I can, Kylie. Yep. So you'll be able to, if you hit control and then you click on all of the files that you want to upload, or you can hit upload more if you want to do them one at a time. You'll be able to use that link to upload however many GACs you need. So if you're submitting 2 months at a time, you'll be able to use that. You won't need necessarily a separate link. It'll be the same link uploading multiple, or the same link, and then you can upload one and then hit upload more. Okay. Any questions on that? The next thing we have on our list is the reporting update. So parent development and home visiting projects are still going to use DAISY. We'll still use the SurveyMonkey links for evaluation for SAP, but the supplemental information, so number of group sessions for family support, number of adult and child sessions for SAP, adult and child SAP services, the information about community development activities or council updates. All of that is going to be pulled in through a reporting link. Great. Let's see if I can find that. It'll be quarterly report form. There will be a link, and it's just going to be an online form that you'll fill out. So you'll put in your contract number 011. Let's say we serve Polk County. I'm Abby Patterson. My email address in, this is for this quarter, and let's say I have a home visiting program. All of that information can just be inputted into this online form. So let's say I had 7 group sessions, home visiting service provision numbers here, if I have a comment on any of that. And then for the Q4 report, we do require what's your participant satisfaction, what data are you collecting for that, and what are you doing with that data? So are you making changes based on what you're doing for participant satisfaction? That's only for Q4. I'm going to pause there and we'll show you the rest of the form in a second. But one of the reasons that we're doing this, we know sometimes grantees have multiple subcontractors. And so there's one person having to compile all of that information into one report and send it. So you might have somebody from the program putting in program information, somebody from the council putting in those council updates. If you have one subcontractor, which is almost everybody, you can come in and do like, let's say I accidentally put 6 and I need to put 7, and this is the second time I filled out this report. You can just come in and only fill out this section and say question 7 updated from 6 to 7. And now I know if I've got multiple entries for this time period, that's because I have an update for this question. For the projects that have multiple subcontractors, you will use this section right here. So let's say I have public health is one subcontractor and LSI is my other subcontractor. If this is just LSI's information, I'm going to put LSI in question number 8, and then public health can put their information and put public health in question number 8. And we will add those together. So you won't have to have somebody compiling that data on the back end, and your multiple people can put information in. Unless we see that there's a note that something is an update and not an add-on, we will do that information on the back end for you. Hopefully that makes sense for folks. So then if you're not doing the program information, let's say you're not working with the program, you can put NA in all of these, click next, and maybe you're just reporting on the community development measures. So you put in your measure and then the progress. So let's say Connections Matter trainings is your first measure, and then you did 2 of them this quarter or year to date. Measure number 2 is Pinwheel Garden, and you did 2 of those year to date. Everything is always going to be year to date, just like it has been in the past. And then you can just enter all of those in like so. And then again, question 18 has a spot for if you have notes on community development, additional information. And then there's a spot for your narrative questions and sharing an impact, a story impact. We will send out this link if you want to flip through and take a look at it. This mirrors the form you're already using. It's just a different way of entering it. It's a different format of how we get the information. It is intended to make it easier for multiple people collaborating on the same project report, as well as make it easier on our end to have everything. If we get a paper report from you and have to enter in data by hand, you know, that's just one more step where we can make a data entry error. Questions. There's a spot for council activities and there's a spot for funding. So if the person's only job is funding, they can put NA in every other thing and just put in, as long as the contract number is right, go in and put that funding information. And then you don't have to wait for your report for the person who does the billing to put in how much money is expended from all the different sources. I'm going to hit submit. And then I can print or get a PDF of my answers. So you'll have you can hit yes to print or get a PDF of that. And then you'll have a copy of everything that was submitted. So if you want to share that with somebody else or print it for your files or save it in save paper, you'll have that as an option. What did I miss, Kylie?
I think that was a good summary. So yeah, it's just let us know if you fill it out more than once, if there's any way that any reason we would need to know why that is, whether it's that we made a mistake or whether this is just additional, just use those note spots to let us know and we'll take care of everything else.
That was a lot. We are right at 3 o'clock. The only other thing I have is, I guess, thanks for all the work you're doing with kids and families across the state. We're hoping that these updates and changes are beneficial, even if sometimes it's bumpy to do things in a new way. You know, we try to be as efficient and make processes that are easy and efficient for you. We are here to help guide you through any of the changes that you may questions about things that you may have. If you have questions about the quarterly report, where should you direct those? Actually, I don't know. Kylie or me, you can send it to the ICAPP. The new reporting form will start with the first quarter report. So the July through September information can be reported in October.
I have a quick question, Abby. How do we know which part, if we are a subcontractor, that we are specifically supposed to be filling out, you know, because we have somebody that's doing the community and somebody that's doing the other part and we're doing the sexual prevention. It just identifies what parts I have put in and I would put NA in the other applicable areas. I'm sorry, I don't mean to confuse. And then also, when will you guys be sending out that link? Because I like to explore.
Okay. I will be sending things out by end of day tomorrow. So that's a great question. We don't typically dictate who's doing what part of the report. We just say, here's all the information we need. But because we understand that different people are filling out different portions, I would say just chat with, if you are the contract manager, if you're getting information doing the reporting, or if somebody else is, chat with them and have a conversation about where the information is coming from and what makes sense for you. So if you're still compiling information, you want to keep doing it that way, that is perfectly fine. Or it's very reasonable to say, hey, you're getting this information. Can you, instead of sending it to me, can you just use the link and send your, or submit your portion online?
None of this form is required except that first page that has the basic contract info. So if you are the subcontractor and you only put in like number of sessions, number of people you served, you can do that first page, click through till you get to the part where you put in that data, and then just click through to finish, hit submit. You don't have to put NA on anything. You can just fill out the contract info and the part that is your responsibility only.
Thank you.
And if we notice, you know, question number 12 is not being filled out by anybody, we'll reach out and say, hey, I see this part was done by this person and these questions were filled out by this person, but nobody covered question 12. I mean, we'll work with you to make sure we let you know if there's something missing.
Abby, this is Pat. So if
Hi,
we have
Pat.
different people contributing to the same report, and let's say one of the people does their section and then I go in to do my section, will I see the other person's? Or am I only going to see the section I'm filling in? So there'll be like, because pretty much we got 3 different people filling in sections.
Okay,
So is there at any point we get to see the whole entire piece completed?
we don't have that capability. I mean, I can pull that information for folks if you need it. It's maybe not going to be in the prettiest format, but I can get you that. Probably the easiest way to do that is doing the PDF, clicking to create a PDF of what you put in. It just won't compile it all together. If that's a feature that people would really, really like, I can talk with, I don't know, Kylie, I don't know if you want to talk about whether or not that's feasible.
I was thinking part of what we've been doing for the CAP program with a lot of their new reporting processes is kind of meeting with folks individually and determining what their process are. Because, you know, some people have one person who does all the reporting, some people have 12. We would be happy to sit down with anybody and figure out, like, how are you managing this? What could we build? We could create you a document that lives on our SharePoint as well, where if you wanted to, you know, work on it on your own time, it's like a Google Doc where you could put your information in and then one person goes in and enter it. Like, there's a lot of different ways you can do that. So some people are like, no, give me as little technology as possible. Some people are like, yes, give me all of the shared documents. So like, whatever you think is going to make this easiest for you, we're happy to support. So just let us know what you're thinking.
Okay, to me, that looks like a lot more work on, although it's electronic, it seems like if you've got 3 different submissions and you're having to put all the information together, it seems like more work on your end than what we have been doing, but yeah, we'll work through it. All right,
Yeah.
thanks.
And like I said, we're happy to set something up that lives on our SharePoint where you and your team can go in together and, you know, enter your stuff so that you can see it, and then you would only have to submit it one time. So let us know.
Great questions. Thanks, Kim. I know that it's a little after 3. I'm not seeing any other. If we get other really good questions that I want to make sure everybody's seen the question, the answer, I will include that in my email. These are, you know, kind of big changes for these processes. So just, you know, we will work through these with you. Hopefully they go as smoothly as possible. But we will do our best to support you and answer any questions in a timely manner, and you know, accept any feedback. We want to know if people have questions or feedback along the way. So again, I'm not seeing any additional questions, so I will go ahead and stop sharing and stop recording here in a minute. And thank you all for your time and for all you do.